Hello, I am Dr. Kolla Vinod, consultant and interventional pulmonologist and sleep specialist, Jaydev Memorial Rashtrotana Hospital situated in Rajarajeshwari Nagar, Bangalore. Rashtrotana Hospital is a 162-bedded multi-speciality hospital with state-of-the-art facilities. Pulmonology is a field of medicine that deals with health of the respiratory system. So as a pulmonologist, I am trained in treating various conditions of the lung such as asthma, COPD, pneumonias, bronchiectasis, diagnosis of lung cancer, tuberculosis and various other lung conditions. As an interventional pulmonologist, I am trained in doing bronchoscopies, which we do for undiagnosed pneumonias and non-resolving pneumonias and for diagnosis of lung cancer. We can also do thoracoscopies, which we do when there is empyemas or pus in the pleural space. We can also do sleep studies, which we do to diagnose sleep apneas so that appropriate management can be given. So when do you consult a pulmonologist? So when you have symptoms such as shortness of breath, cough, sputum production, wheeze, chest tightness, hemoptysis or blood in sputum and chest pain, which may be secondary to air in the pleural cavity such as pneumothorax or fluid in the pleural cavity such as pleural effusions. So today I'll be talking about COPD, chronic obstructive pulmonary disease. So it is a heterogeneous lung condition characterized by symptoms of shortness of breath, cough and sputum production, which is usually progressive and is associated with abnormalities in the airways such as bronchitis, bronchiolitis and in the alveoli such as emphysema. The difference between COPD and asthma is that asthma is not a progressive disease and has symptoms such as shortness of breath, cough, wheeze and chest tightness with variable expiratory airflow limitation which vary over time. Coming to causes of COPD, the most important cause is smoking. Smokers usually have more respiratory symptoms and decline in lung function. So smokers are at highest risk of developing COPD. Next common causes like occupational exposure of chemical agents and fumes, biomass fuel exposure. So burning of animal dung, crop residues and wood and coal in open fires can lead to development of COPD. You have genetic deficiency. Sometimes hereditary deficiency of alpha-1 antitrypsin can lead to development of COPD, especially in the young. Then air pollution is also an important cause of development of COPD. So what happens in COPD? COPD is associated with inflammation in the lungs. This inflammation may occur in the lung parenchyma, airways and or alveoli and pulmonary vessels. This inflammation is usually due to increased amount of macrophages and activated neutrophils, which release inflammatory mediators which lead to destruction of elastin, which is an important connective tissue component of the lung parenchyma. How do you diagnose a case of COPD? So usually when a patient comes to us, we get an X-ray done. Chest X-ray may show hyperinflated lung fields, flattened domes of diaphragm, a tubular heart. Then we can get a PFT done. Pulmonary function test may show an obstructive or restrictive defect usually, but in COPD it will show an obstructive defect. Obstructive defect with poor reversibility is a characteristic sign of COPD. We calculate forced expiratory volume in the first second, forced vital capacity and FEV1 by FVC ratios to determine the obstructive ratio and the reversibility ratio. Then we can get an HRCT chest done to know the extent of involvement of COPD. Exercise testing can also be done like 6-minute walk test, which will show the disability ratios, the mortality rates and the effectiveness of pulmonary rehabilitation. So how do you manage a case of COPD? So Coming to management, you have non-pharmacological management, pharmacological management, and interventions in COPD. So non-pharmacological management, the most important is smoking cessation. So smoking cessation is the most important factor which can change the course of COPD. So a brief strategies to help the patient to quit smoking are 5 A's: ask, advise, assess, assist, and arrange. So ask, identify all tobacco smokers during every visit. Advise them to quit smoking. Assess their willingness to quit. Assist the patient in quitting smoking, and arrange for regular follow-ups. You have nicotine replacement therapy, which can be given in the form of patches, sprays, and gums. Some pharmacological agents are also present for smoking cessation, like bupropion, nortriptyline, and varenicline. Then coming to other non-pharmacological treatment, you have vaccination, flu vaccination, and pneumococcal vaccination, which can reduce the number of exacerbations and hospitalizations. Coming to pharmacological management, you have bronchodilators and anti-inflammatory agents as a whole. So bronchodilators and anti-inflammatory agents, you have both long-acting and short-acting. They are available both in the oral and inhaled form. Inhaled form, you can have it in your metered-dose inhalers form, dry powder inhalers form, and nebulized forms. Beta-2 agonists and antimuscarinic agents are bronchodilators. So bronchodilators increase or improve smooth muscle airway tone so that it improves expiratory airflow. Whereas anti-inflammatory agents, which also can be given in the oral and inhaled form, suppress the progressive inflammation present in COPD. Both anti-inflammatory and bronchodilators can be combined and given in the inhaled form for appropriate management during exacerbations and for long-term management in stable patients. Coming to other interventions in COPD, you have lung volume reduction surgeries, which will improve mortality rates and improve quality of life in patients with severe COPD despite maximal medical therapy. Then you have pulmonary rehabilitation, which will improve the health status and improve exercise tolerance in patients with stable COPD. Coming to bronchoscopic interventions in COPD, you have endobronchial one-way valves, airway bypass stents, self-activating coils, sealants, and vapor ablation, which help in improving the quality of life, improved survival of the patients of COPD, decreased mortality rates, and improved exercise tolerance, especially in patients with severe COPD. In patients who have respiratory failure, long-term oxygen therapy can be given, and appropriate management such as invasive and non-invasive positive pressure ventilation can be given. In patients with carbon dioxide elevation, patient can be given bi-level positive airway pressure depending upon whether he is in an exacerbation or not. So if you find that you fall in the category of COPD or asthma, you can come and have a check with the pulmonologist in Rashtrotana Hospital. Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.